Well, Valentine's can be one of the loneliest days of the year. Almost all of us have had their heart broken at one time or another. Dr. Timothy Quinn practices family medicine up in Ridgeland. He joins us now in the studio to talk about broken heart syndrome. First of all, Dr. Quinn, thank you so much for decorating the set today. And how can the pain of a breakup manifest itself physically inside our bodies?
Well, I mean, broken heart syndrome is a perfect example, and it's a real medical diagnosis. I mean, it's recognized by the American College of Cardiologists. My first encounter with this type of patient was many years ago. I was doing my residency in Los Angeles. I was working in the emergency room on Valentine's Day night, and a lady came in, and she had chest pain, shortness of breath. You know, so we did the cardiac enzymes. They were positive. We did an EKG. It was positive. So we admitted her for a heart attack. The next morning, we did the cardiac cath, but there was no coronary blockage, which is not usual for a heart attack. But then we did the echocardiogram, and there was ballooning of the apex of the heart. And we became much more suspicious, maybe not, but when we got the history, we got our diagnoses. The deal is, she told us that right before the chest pain started, she got a phone call from a man that she loved. I mean, this was a man she was going to have children with, start a whole life with. He told her he did not love her, and he would not be spending Valentine's Day with her because he was going to be with the woman he truly loved. This caused her so much stress and anxiety. She had the chest pain and ended up in the emergency room, and we had our diagnosis of broken heart syndrome.
And this could have killed her. What are some of the positive steps you can take? Because everybody does get their heart broken at some time or another.
Right. Well, I'm working with Chris Mims with the American Heart Association, and we did a lot of research. And we found a common denominator for those that suffered the significant, potentially deadly consequences of broken heart syndrome, which could be cardiac shock, which could take your life, or even chronic congestive heart failure. And these individuals had pre-existing heart conditions. That's why the American Heart Association recommends that everyone exercise, eat healthy. If you take medication, take your medicine, follow it with your medical provider, and that way you can have as healthy a heart as possible. And if you do get your heart broken, you have a better chance of not suffering these severe, potentially deadly consequences.
And what advice would you give for people that do have to spend Valentine's Day alone? It can be an awfully lonely time of the year.
Oh, yes. I mean, I get so many patients that come in with anxiety and stress because they don't have a Valentine's Day. But I tell them to do as I did. I mean, before I got married and met my beautiful wife, I used to spend time with my friends and family. And we'd watch television shows or maybe cook some food or watch a movie. I strongly don't encourage them to go out on Valentine's Day and try to meet somebody in a very desperate scenario, because it's best to just meet somebody in a very relaxed environment with no pressure, get to know them, and that way they have a better chance of a long-term, healthy relationship.
That's it. Just spend time with your friends and family. The right one's going to come along sooner or later, right, Doctor?
Exactly. I mean, time, it takes care of everything.
Even on Valentine's Day.
That is correct.
Dr. Timothy Quinn practices family medicine up in Ridgeland. Thank you so much for taking time to talk to us today, and thank you for the lovely flowers and the candy, too. You're watching 12 News at Noon.